Thank you, Adam, for inviting us. It's a privilege to give you a talk on communication. The reason is the topic I've chosen about this is because I represent the medical profession, as you're aware. I come with our brothers, I call it, to help you communicate with the doctors and healers. Doctors and healers go together. For the healing profession, it's medicine. And medicine always been healing for thousands of years. And I'd like to put myself down on the pedestal now because I'd like to show you what a typical consultation is like in a doctor's office. So I'd like to enlist the help of lovely Luke, which Judy, our receptionist, booked into appointment this morning. Now, although we are sitting at 45 degrees, in a doctor's office, it's usually different. Doctor face usually towards the scenery or window or wall, and the patient sit on the side. So I might be sitting like this. And so we're not actually confronting, not facing each other at all. So look, why are you here today? What brings you here today?
Well, today I've just come in for a general checkup.
Okay, so I tap the thing on the general checkup. Item number, oh yes, okay, good. What kind of checkup are you after today?
Oh, you know, the general sort.
Okay. Any reason?
Oh, not really. My wife told me to come in.
Is your wife here?
Oh, she's in the car.
Okay.
She's making sure I came in.
Okay. What symptoms are you having these days? Do you have any symptoms?
Oh, I got a stiff arm when I wake up.
Okay. How long have you had it?
Oh, I don't know, about a month or two.
Now, this is an example. If it was a lady patient here, I won't be able to ask series of questions. I'll be there listening. They'll be telling me for the next 5 minutes about all the symptoms, but what they've done at the shopping, what's happened on the way to the doctors. I'll have to interrupt it to director. With a man, it's a bit different. We talked about that yesterday with Bill Foley, Professor Bill Foley. I have to ask series of questions to get that out. Now, I might invite Luke later for another consultation. Thank you, Luke.
Thank you.
Cheers, So there was a big study done on consultation with doctors. I mean, this is a huge event. Well, sooner or later, you have to visit the plumbers. I admire Adam because this morning when I was seeing him drive his car to the car park, he had his tools behind his car. Now, to me, I have these wonderful tools, which are like $500,000 each, but I can't carry them. You know, who has the key to my tools? It's the nurses, women. So I have to ask them to open my tools. And he has access to his tools by himself. So I'm very impressed, actually. Next time I come as a builder. So in 1950s, there was a big study done about consultation with doctors and patients. And there's this third party called illness. It's like a third woman. Ooh, could you imagine this? And so this study was ordered by the College of Physicians in London, the epitome of medicine. If you want to be doctors, you go to London. That was what 1950s was about. And this study was done on two psychologists, two female psychologists. Amazing study. It was an external study never seen before. And they realized that consultation is a role playing. They will play a role. It's like going to a drama class. Doctor plays the role that they learn in medical school. It's like a format. It's like a storyline that you learn. I've learned it too. There's a subject dedicated to this, medical interview, PX302. I remember the quote well. And you know what? I actually failed that subject. I had to do a sub that's the one subject that I only failed in medical school, I might add, because to me, it didn't make sense to me. Why do we have to run lines to consult the patient? That's the thing. It didn't really boil down to me. So you are being shared of these medical stories by a failure in medical school. So the most frequently used drug, of course, is the drug doctor. This is not the doctor that uses drug, but it is the doctor being the drug. And there was the medicine in 1920s to 50s. The old-fashioned doctor visiting you at home, holding your hands, and say, you know what? You're going to die, but you're going to be okay. And compared to these days, where trend is, we are losing that art because the tradition has changed. And maybe doctors are becoming more overwhelmed by the statistics that Stephen has kindly presented. It's quite overwhelming. But to me, I see beyond the statistics. Like I was sharing yesterday in the meeting, I'll repeat this for you, it's very important. My wife and I, we go shopping, Westfield in Brisbane somewhere. I don't want to advertise them too wide. And she sees beautiful things, like what Bill Foley was talking about. You know, they feel feelings about things. I see bodies and I see, that lung function not right. That hip's not right. Their liver is bad. So I see organs. It's like a Superman movie where Christopher Reeve got Margot Kidder. You know that scene where he looks at X-ray vision, looking into the lung. Emphysema there. So the doctor is the drug. That was what the tradition was. And the role of the attentive listening was very important. We are trained as doctors, and healers too, to look at non-verbal cues, that you don't have to speak. But the thing is, we're not trained in this anymore. We rely on clinical signs and symptoms to ask questions like what we've done with the look before. So when we are confronted with a man especially, who just comes from a short one-liners, we don't know what to do with ourselves. Because we're not trained in that, unless we open our heart and say, you know what? There's one more to this, what they're not saying than saying. So asking questions only answers the question that's being asked. So if you don't ask the question, how are we going to diagnose you? Put you a CAT scanner, MRI, do every test known to man, and you realize probably have to wait another 2 years to detect a small cancer that we could have prevented 2 years prior. So Stephen talked about body image, very important. You know, I'll share a story with you today. I have a lot of stories, but this one's an important one. 2 months before Christmas, now we have 5 weeks to Christmas now. About 2 months prior, the hospital system is the busiest time of the year. You know why? Because everyone wants to get fixed up before Christmas. All the relatives are coming. You know, all the families are coming too. In a private world where the money speaks, and this is an unfortunate trend in medicine, you want to get fixed up plastic surgically, I better do the boob job, nose job, better take the gallbladder out. Our cardiac ward, which is 40 beds, are full because they have to get the sternotomy where you crack the chest open, fix that heart so I can have the Christmas party where January to April to June, when the winter comes, it's really quiet in those fields unless the acute crisis happens. Because it's all over now, we can rest. We'll let the year go by. So why do we wait until we have serious disease or major celebration events like Christmas? So keeping the body image is very important to us for now. Then really getting to quality of life and health. We don't even know what well-being means now. I had a lady, that's the thing about our field, we look after a lot of the elderly, and then a lot of medication. Medicine is part of the problem, but the problem is they're not really well-being. They're just maintaining. So this is very important, that what Adam talked about quality of life. Body awareness is very important. I put this picture for you because when your bladder's full, you know you have to go to the bathroom. We know that. Average is about 5 times per day. That's the average. And average flatulence, passing wind, is about 20 times per day. Gee, even I don't do that much. So that's body awareness. But the thing is, if it was all about prostate cancer, that would be the simplest thing. But as Stephen presented, it's a representative of underlying problem. Diseases don't come in isolation. I'm a bit of fraud, actually, because I trained as a lung man lung specialists, whatever they call, rare disease they call it. But 20% of my work is actually pure primary lung disease. I do gynecology now, non-invasively of course, and I also do cardiology, general practice, skin, etc. Because people with lung disease come with other diseases too. And I'll show you why. Big study done in Europe. It's only recent, 1998. It's only representative. I actually admire these people. These were a bunch of social workers and psychologists and one GP who decided to do a study in general practice and interviewed 1,700 men nearly and studied how many proportion of these people have urinary difficulties, like whether having urinary problems, passing urine frequency, whether after even passing urine, whether had difficulties at all. And we found about a quarter of these men had difficulties. Quarter of these men out of community, just randomly selected. But only 10% present to their doctors, actually. Despite the fact up to 2/3 had a major impact on their life. Erectile dysfunction, having sexual difficulties. So the question is, if we're having suffering so much, why are we holding off so much of getting some help? And important statistics to do, very important, is that a lot of these people smoke too. So there are other things going on. Maybe the difficulties in the urine is only a symptom of what's happening in their life. Maybe they may be depressed. Maybe there are things they haven't resolved. So these are things that they'll come out in the consultation unless the man's able to open up. And a lot of that is feeling, I'll show you why that is. It's good to understand about prostate. I have one too. Very important organ. But its main function is endocrine and perhaps holding the outlet of the bladder. So bladder holds the urine and prostate is underneath. It only weighs about 5 to 10 grams. But it causes so much misery. And I mind you, I might just try this differently today. To your partner next door, if they can allow you, just use your index finger. So you can turn to your right or the left. Just touch the tip of your nose of your partner. Good. So that's what the normal prostate feels like. Now, could you do the same, but squeeze the chin of your partner hard with 2 fingers, gently. And that's what prostate cancer feels like. So prostate cancer is pretty firm. It's like a concrete, isn't it? And prostate cancers only grow the organ maybe 25-30%. And that's enough to block this bladder, leave about half liter of urine just stagnant there every time you pass urine. So you're actually holding on to all urine. Could you imagine this? So getting personal is a bit deeper now. I had to have this in April because part of the insurance thing. When you look after a lot of organizations, you need to look after yourself. So that's very important. It's no longer about you. But getting personal isn't about getting a date. It's about have the vulnerability and acceptance to say, you know what, I'm okay. I'd rather not die of cancer. I'll let someone else put a finger in my bum for 3 seconds. Make sure that it feels like my tip of my nose. And just say, on the way out, please, just wipe my bottom so I don't soil my undies. And I did that when I had a prostate exam in April. And my GP, who's a lovely colleague of mine, who said, you know what? You're the first one to ask me to wipe your bottom on the way out. Because I had to work that afternoon, Very important. That's the integrity that we should be taking it. So for you to claim and say, you know what, treat me with the respect, because I'll allow you to open my bottom, but please look after me. If you did that with a loving attention, even the hardest doctor will open up. And you don't even need to tell them what to do. And that's how medicine will change, through you. Because I'm surrounded by top surgeons everywhere. Like on my floor, I counted 8 orthopedic surgeons. And a lot of them treat famous people, like Broncos, footballers. Then on the top floor, I have cardiac surgeons who've treated prime ministers. I don't know which one, but I can tell. But heart disease is a huge problem. It's 1 in 2 Aussies get affected. It's not just Australia here, it's everywhere. And it scares people because everyone thinks heart attack. Oh, it attacks, heart that attacks. But it's actually very preventable. So why do we complicate so much? Because, this image is so common. I've done this too. Like, on your desk, you complicate, you sit down, and then you think about everything that could go wrong, not realizing that healing and medicine is a process. You deal with one at a time. You don't have to do everything in one go. It's like your car tune-up. In 6 months, you might change the carburetor. And then 6 months later, you might call Adam and say, Adam, the engine doesn't sound right. What do you think? I'll just change the filter. Okay, I'll do that next. And then 6 months later, change it again. It's an evolving process because our body's changing. Women are very good at that because they have monthly changes. Gee, if men had monthly changes, I bet you those tampons would be subsidized by Medicare. I can tell you this. So may I just present to you the second scenario in consultation. So I called Judy, receptionist. It's a 3 o'clock appointment, late afternoon. I met 1 hour because he rang me and said, or ring Judy and said, need a long consultation. So he arranged it for not just 5 minutes, 1 hour, 45 minutes sometimes. So we look, you're back again.
Yes, it's good to be back, Dr. Sam.
Yes.
And you're looking quite well today.
Oh, thank you. So what's been happening with your life since the last visit?
Well, since last time, been really feeling a lot of stress at work so far, and I'm feeling it's really affecting my lifestyle. I feel that when I want to do something, I want to help for my health, like go for a walk, it always seems to come up and stress me out, so I can't get that proper routine anymore. And from there, I feel that I get really drained and really, really tired, and then from there, I just get all stiff, and I feel that that's contributed to my indigestion I've been feeling. So a lot of things going on, isn't it? Yes.
So should we focus on one thing today?
Yes, we should.
Then we can work from there. Because, if there's a lot of symptoms there, most doctors will get overwhelmed. But remember how Luke presented this. He made it really personal. It's affecting his life. And even the hardest doctor have to listen. And if he doesn't listen, find another one. That's okay. Doctors can handle it. Because those ones will have to claim themselves and say, you know what? The world of patients are changing. We need to grow up. See, that's how medicine grows. That's how I've done it too. If you see me 10 years ago, I wasn't always like this. I was what I call pancreas-driven, on the ball. Those ER, the show? I was 3 times worse. I can tell you. Even before the beeper went, I was there. These days, beeper doesn't go off. I don't keep it because I feel what's going to happen next and go there before that happens. So medicine can change through patients. Thank you, Luke.
Thank you.
So to end the talk, so much to talk about, but I would like to share this with you because I got permission from my father. As you know, he born in the 1940s, the traditional man. And he was a role model for me too. And this happened about 2 months ago. He rang me one day, Monday morning, very busy morning, patients everywhere. There is a phone call from my dad saying, you know what, for 3 days I've been having this heartburn every time I did gardening. He loves gardening now after retirement, as most retirees might do. And he said, you know what, I told him, you don't usually get heartburns, do you, Dad? I said, yeah, but I'm sure it's a heartburn. He was trying to override it. His head was trying to override it. But I know he doesn't get heartburns. And although he never smoked in his life, it sounded so unusual for him. So I asked him, maybe you should consider seeing someone. He said, Do you think I should? I'm sure it's a heartburn. But I told him, I advised him, you know what, you don't usually get heartburns though. He said, yeah, you might be right. So 1 hour later, he sees this general practitioner. Quite amazing, because you can't get to the GPs that quickly these days. But he must have presented in an urgency. And that's the thing. You can push the system by your genuine urgency of the problem. And the GP rings me up and did the same thing. You know what, it sounds like heartburn to me. Doesn't have the risk factors. Possibly he couldn't have heart attack, heart angina or whatever. And I said, but you know what, I know it doesn't have the risk factors, but heartburn, very unusual for this man, for my dad. Would you consider doing some tests? And GP really felt the message from me. So this is the importance. Men don't have to do this medical thing, healing thing alone. There's a lot of support out there, not just men, but your sons, your children, brothers, relatives, doctors, healers, etc. And so that afternoon, middle of the night, he had an angiogram. And basically that showed, I'll show you this very tiny blockage, or 99% blockage, on a main artery of his heart. Now, if that got blocked critically, you'd have died very suddenly. That's why they call sudden cardiac death. You just drop dead on the concrete. You will supply most of your heart. There's an important message here. One, this man had a normal ECG, blood test, cholesterol. So Stefan has presented us statistics that we can have so many millions of people diagnosed with heart disease and diabetes, etc. But you must also realize the quality and the nature of our disease is changing. That you can have normal x-rays, normal tests, can still have disease. So the best diagnostic tool that you can have is your body's awareness. You have to feel your own body. Doesn't mean you put your finger in your bum every morning and do that. I can't say I have to try that, but I didn't. But it's very hard. For women, breast examination is very gently, lovingly done. Testicular exam, we didn't mention here, it's the commonest cancer in young men. And 99% is preventable just by feeling your testicles. Ooh. So, body awareness. Just be aware the quality of disease is changing. And the second thing that you must realize is that modern medicine cannot detect every disease early. We have to do that. We are the medicine. And that's the important thing about where we are heading. So starting the conversation is about that, is body awareness. Being the self-plumber that we are, from the deepest truth that we hold in our body, and express it with our openness, with our practitioners, and honestly, like Luke has represented for you, share with your doctors, and even the hardest one will listen and say, you know what, I will help you. Thank you.